So I'm big into body mobilizations, which is also assessment. With my eyes closed, I can feel what's going on this side of her neck, what's going on this side of her neck. I can roll. She's helping a little bit, so I just say, take a deep breath. Movement is healing. When you stop moving, you begin the slow decay of death in your life, emotionally, spiritually, physically. So just by having her relax and me mobilizing her neck is therapy. Rosalie wanted to review the Bob King technique. Since I was a student of his at the Chicago School of Massage Therapy, it's just mobilizing the cervical vertebrae with or without lubrication. It's also a way to assess.
Is it best without lubrication?
I like to start out everything without. Now this side is tighter. So I may focus on this side first, and I will. There's barely anything at all. My work is very dry because it's very site-specific. My fingers are still fine 15 years later because I take really good care of them after I work.
What do you do?
Yoga, self-applied massage. I sit in the whirlpool at the fitness center and let my arms go up against the water jets. So one thing that you can do for traps, and scalenes, and the levators, do a tense and relax game. Make an X. Fist underneath, palm on the shoulder. When you inhale, lightly shrug your shoulder and tilt your ear towards your shoulder.
Okay.
And then exhale and relax. Back to neutral. Inhale and tilt and stretch and pull up. Oh, good. And exhale, relax. And back to neutral. Inhale, shrug and tilt. And exhale and relax. So it's 3 reps, and the last one you hold it. You can just have her shrug the shoulder if it's too complicated, or just tilt the ear if it's too complicated, or get both. I hold the final stretch 30, 40, 50, 60 seconds. Let's say that was 30 seconds. I'm going to come back and go, hey, how's it feeling now?
Looser.
Looser. And that's without doing any massage.
Wow.
I would do that after muscle stripping the trap, the levator, the scalenes in here. And I'm almost always moving. I seldom do work static. Almost always moving something. How's it feeling here?
It's a little sore.
A little sore. So I'm going to use pressure about a 3 or a 4. On a scale of 1 to 10, it's
Maybe 4.
okay. Take a big deep breath. Let it go. Tell me when the 4 goes to a 2.
Yes.
Okay, I'm going to increase pressure. Does it come back up?
Mm-hmm.
Okay. Same process. Deep breath. And I'm breathing with her too.
Okay, it's good.
Okay, so that's going under the radar in a trigger point. She reported it was sore. I felt it was very tight, so that's a knot or a contracted spot of tissue. By her deep breathing and my direct pressure on pain at about a 4, it's not agitating, it's not relaxing, it's inviting stimulus in the central nervous system to go, oh, stimulus. It's not too noxious, so what should we do? Not sure. Deep breathing will calm down and relax. So after that, I will stretch her scalenes out. If I don't, it's going to come back in a day or 2. And this is when I would do the tense and relax game, which is also called a muscle energy technique, the tense and relax game. We could also do a pin and stretch game. I come back in here, find the spot, and when you inhale, exhale, let's stretch to the side together. I'm pinning the muscle and stretching it. Inhale back to neutral. And exhale, let's stretch it together. All right, one more time.
So I'm helping, right?
Mhm.
Stretch.
Active
Okay.
pinning and stretching. Passive is you just breathe and relax and I stretch it for you. So to end treatment of her scalenes, before we warmed it up, we did some muscle stripping, we found that tightness in there that was sore, we did some specific trigger point therapy on it, and then we pinned it and stretched it together, or we did the tense and relax game together. Right? You inhale, you push. You exhale, you relax. And just stay relaxed now. So getting the exacting protocol down isn't what you need to do. To get a general idea of how to do it is, and then practice it. Okay. So that's the scalenes, doing some tensing and relaxing and pinning and stretching. Now the Bob King special is coming back here next to the vertebrae. I'm not on the spinous process, I'm next to them. I'm just milking up. Milking up. If I had more lubrication, I could do the wave game. I can just come all the way up.
Oh, I see.
And she's even coming up with her head a little bit, so I'll just say,
Yeah.
just breathe. Her head gets heavier. That's cool.
All the things I tell my clients to do,
Exactly.
I'm not doing.
Right. And this feels so good. Just doing this. Okay, the infamous SCM. Tilt the head to the same side. Pincer grab. The SCM. There's trigger points up and down both heads, the sternal and the clavicular head. I'm just milking, myofascial chewing it's called. One spot for a few seconds, then another spot.
There are trigger points there.
What does it feel like?
It's a little sore.
In here?
Right where your thumb is.
Okay.
Yeah.
I want to find a pay dirt trigger point. There's central trigger points, and then there's satellite, or primaries and secondaries. If you deactivate the central one, the satellites will deactivate on their own. So I'm trying to find the one that goes zing for her.
The one that makes her levitate.
Exactly. She may not have one. How's
That's a little worse.
Okay. So I'm jostling her. So, okay, relax. We found a good spot. And I just breathe. And I'm holding the spot. I'm not letting up tension.
When it's releasing.
Okay, I'm going to increase my pressure a little bit. Just an ounce or two. Does it come back a little bit?
Just a teeny bit.
Okay, so just breathe.
Yeah, it released.
Released. So to stretch the SCM on one side, we bring the hand under, come under, and move down. But by stretching this side, we're tightening up the other side. Okay.
You're pinning at the clavicular.
Exactly. Before I began to start to work on the suboccipitals by doing the Chicago School Special wave technique. But if I end up right below the skull and move out laterally and hang around C1, C2, we're going to start to get some of those suboccipitals. You can work one side, you can work both sides together. And I encourage you to start to get familiar with your ring fingers, because we always work with our first and second fingers, and those will get blown out the fastest.
And you're using your ring finger?
Right now, you're right there,
Yeah,
on both
there's
sides.
there's quite a bit of pressure.
Strong like bull. Okay, I'm going to show you the suboccipital X stretch. Let's say we just worked her left side for a few minutes, and it needs a good stretch. We need to pin the left shoulder down, and then stretch up. Can you feel it? Okay. You'd be surprised how far the head can go forwards. And back down.
Yeah, sometimes I'm afraid to push it too far, but it really can.
So to stretch to the left, we anchor the right. My hand comes up underneath her, basically in the same line as her SCM. I'm at the base of the skull.
Popped.
That's nice. One more thing. This is movement of the neck. My fingers are alternatingly putting pressure on the lateral musculature along the cervical spine. It's like playing a flute, piano or something. I could stabilize the opposite side with my thumb.
Your fingers are on the right side.
Uh-huh. You can get displaced vertebrae to realign.
We can't see, where are your fingers right now? Like what muscle group?
Come on over here. So right posterior to SCM.
Okay.
So there's some scalene involvement. There's posterior cervicals, levator scapula. So the first way is just your fingers. And move the head. If she's helping, say, take a big deep breath. Your head is a big rolling ball. And it works a little bit on her, yeah. And then I can bring the thumb out on the other side. And really feel where there's tightness. And play with it.
Tight right there.
Yeah.
A little pain.
Okay. And then to stretch this one, both shoulders up.
Have you got your arms crossed?
Mm-hmm.
Oh,
I'm an X-man.
okay.
Hugh Jackman. Man.
I like him.
So for review, scalenes, trigger point technique. For any muscle, you find the tightness, the hardness, the painfulness. You hold with pressure, pain 3 or 4. They deep breathe, they relax, it goes down, you increase pressure. Stretching, tense, relax game. She inhales, she tilts and shrugs. Exhales, goes the other way. And she holds and relaxes. Sternocleidomastoid muscle, you turn the head to the same side and you milk it. Up and down. From the occiput all the way down to the sternum. You can warm it up with bilateral massaging, effleurage. The Chicago School wave. You can get back here, you can just go all the way up, one smooth stroke, or stop in between each joint. Just say hello. All right. Thank you.
Great.